Medial pterygoid muscle. As the name goes, medial pterygoid or mesial pterygoid, this muscle lies mesial or medial to lateral pterygoid muscle. Origin of this muscle is from 1 and 2. One is, first is maxillary tuberosity, which is the raised projection at the end of the maxillary bone, which we see distal to the sockets of the last socket. So the first is from maxillary tuberosity. The second origin is from the medial surface of lateral pterygoid plate. We have seen that lateral pterygoid muscle arise from the lateral surface of lateral pterygoid plate. This medial pterygoid muscle arises from the medial surface of lateral pterygoid plate. So this muscle has two fibers, superficial fibers and deep fibers. Superficial fibers are from maxillary tuberosity, whereas deep fibers are from the medial surface of lateral pterygoid plate. So this muscle shape is quadrilateral in contrast to lateral pterygoid muscle, which was cone shaped muscle. So this muscle, after arising, inserts into the medial surface of the ramus of the mandible, and some fibers insert into the angle of the mandible also. So the insertion is in the medial surface of the ramus of the mandible. Nerve supply is by the mandibular nerve, and this muscle is also derived from the mesoderm of first pharyngeal arch. Actions of this muscle. So the action, we know that origin pulls the insertion. So the first action is the elevation of the mandible or closing of the mouth. So because in action we see that origin pulls the insertion, and the second action is the protrusion of the mandible. We can see the direction of the origin and insertion, and the last is side to side movement in grinding, which is similar to lateral pterygoid, because this muscle also runs downwards, backwards and lateral. The origin is mesial and the insertion is lateral. So along with lateral pterygoid, left lateral pterygoid and left medial pterygoid, when they contract, they pull the mandible towards the opposite side. So this is the action of medial pterygoid muscle. Relations of medial pterygoid muscle. Superficial and deep relationships. Starting from superficial relationships, this is a medial pterygoid muscle, this is lateral pterygoid muscle. Superficial means external to or lateral to medial pterygoid. So the first relation is lateral pterygoid plate. This plate is superficial to medial pterygoid muscle. Then second is lateral pterygoid muscle. Third is this maxillary artery. Fourth is inferior alveolar nerve, and fifth is the lingual nerve. So we have 5 superficial relationships of two medial pterygoid. Number 1 is lateral pterygoid plate. Number 2 is lateral pterygoid muscle. Number 3 is maxillary artery. Number 4th is inferior alveolar nerve, and number 5th is lingual nerve. Deep relationships, which are deeper or medial to medial pterygoid. This is a medial pterygoid muscle. We have superior constrictor of pharynx muscle, which is deeper to medial pterygoid, tensor palatine muscle, stylopharyngeus muscle, and styloglossus muscle. So medial to medial pterygoid, we have tensor palatine muscle, stylopharyngeus muscle, styloglossus muscle, and superior constrictor of pharynx muscle. So these are the relations of medial pterygoid muscle, superficial and deep.